Hello friends, welcome to my YouTube channel. So today we are going to see about the shoulder joint. It is very important essay question for your anatomy university exam. The shoulder joint is also called as glenohumeral joint. Let's see shoulder joint under 11 topics. That is introduction, bones involved, types and subtype, articulating surfaces, stability, ligaments and accessory ligaments, movements and muscles involved, blood supply, nerve supply, bursae, and clinical correlation. Introduction. The shoulder joint is a polyaxial joint, means the joint could move in any direction or several directions. Next, it is a spheroidal. Spheroidal means it's a spear-shaped, flattened on the peripheral surfaces. And then synovial joint, because it is filled of synovial membrane between the bones of the upper limb. And then it is the most movable joint and least stable joint of the human body. Let's see this in detail, this point in detail within a while. It is a part of shoulder joint complex. Glenohumeral joint is a part of shoulder joint complex. The shoulder joint complex involves glenohumeral joint, that is the shoulder joint, acromioclavicular joint, sternoclavicular joint, and scapulothoracic articulation. So here is the sternoclavicular joint. This is the sternum and this is the clavicle. So it is called sternoclavicular joint. Then is the acromioclavicular joint. This is the acromion process and this is the sternoclavicle. So this is called acromioclavicular joint. Then is the glenohumeral joint. That is, this is the glenoid cavity of the scapula and this is the head of humerus. So it is called glenohumeral joint. And then scapulothoracic articulation. The scapula which is behind, this one is the scapula. And then this is the thoracic vertebrae. So it is called scapulothoracic articulation. So now we have seen the introduction part. Next let's see the bones involved. So the bones involved are head of humerus and glenoid cavity of scapula. Let's orient this with a picture. So here, this is the head of humerus and this is the glenoid cavity of scapula. We said the head of humerus and glenoid cavity of the scapula is togetherly forming the shoulder joint. So this is the head of the humerus and this is the glenoid cavity of the scapula. Now we already said that the joint is most movable joint and least stable joint. Next, let's see about the type and subtype of the shoulder joint. So the type and subtype. It is the synovial joint type of ball and socket variety. Articulating surface. The round head of the humerus, large round head of the humerus, articulates with the glenoid cavity of scapula. This is why it is called glenohumeral articulation. Now we already said that it is the least stable joint and the most movable joint. So the least stable joint is a disadvantage. That is because the head of humerus is roughly four times larger than the glenoid cavity. Let's see this with the example of a picture. So here, this is the head of the humerus. You can see how large it is compared to the glenoid cavity that is very small of the scapula. This is why it is like least stable joint. But because of being least stable, it also has an advantage, that is being most mobile or like most movable joint. So whenever whenever a structure is like low in stability, it has inbuilt structures to build up its stability and make it more stronger. So there are four structures that increase or that provide stability to the shoulder joint. That is, one is the coracoacromion arch, then the rotator cuff muscle, glenoid labrum, and large head of triceps and short head of biceps. So the coracoacromion arch is contributed by three structures, that is coracoid process, coracoacromion ligament, and acromion process of scapula. Let's see this with a picture. So here, this is the acromion process and this is the coracoid process and this is the coracoacromion ligament, this green color thing. So these three together contributes the coracoacromion arch that provides stability to the shoulder joint. Next is the rotator cuff muscle. That is, rotator cuff muscles are four muscles, that is supraspinatus, infraspinatus, teres minor and subscapularis. Next is the glenoid labrum. So the glenoid cavity is lined by a fibrous structure called glenoid labrum. This blue color thing, this deepens the glenoid cavity. The function of it is to deepen the glenoid cavity so that it provides a little more space and little more stability for the round head of the humerus to attach into the glenoid cavity. And the last one is large head of triceps and short head of biceps. Next, let's see about the ligaments. There are four main ligaments and two accessory ligaments. First, let's see about the four main ligaments. That is, the first one is capsular ligament or fibrous capsule or joint capsule. So the capsular ligament is loosely attached to permit free movement of the shoulder joint. It is loosely attached so that the shoulder joint could move freely. There are few exceptions in this, that is inferiorly, that below, this is the inferior part. Inferiorly, the capsular ligament extends up to the surgical neck. So here, this is the surgical neck. This one is the surgical neck. So inferiorly, it extends to the surgical neck. And then superiorly, it is deficient for the passage of tendon of long head of biceps brachii. So medially, the capsular ligament has glenoid labrum, and laterally it has the anatomical neck of humerus. So here, medially, it has the glenoid labrum. We already said that the blue color thing is the glenoid labrum, and laterally it has the anatomical neck of humerus. This is the anatomical neck of humerus. There are few exceptions in this, that is inferiorly, that below, this is the inferior part. Inferiorly, the capsular ligament extends up to the surgical neck. So here, this is the surgical neck. This one is the surgical neck. So inferiorly, it extends to the surgical neck. And then superiorly, it is deficient for the passage of tendon of long head of biceps brachii. So and anteriorly, it has supplementary bands called the superior, middle, inferior glenohumeral ligaments are present. Now these exceptions come under lateral surface of the ligament. Now let's see the inferior surface of the ligament. So inferiorly, the joint is like least supported. The capsular ligament is least supported because there is like a capsular ligament is not present. It's very deficitly present in the inferior part of the shoulder joint, because of which dislocation of the shoulder joint is most common inferiorly. And inferiorly, you have axillary nerve passing through. So this dislocation, inferior dislocation of shoulder joint, which is most common, can also cause damage to the axillary nerve. Now let's see the next ligament, that is coracohumeral ligament. The coracohumeral ligament extends from the root of coracoid process to the neck of humerus. Its main action is to strengthen the capsule. Next is the transverse humeral ligament. The third one is the transverse humeral ligament. It bridges between the bicipital grooves, and then the other thing is the tendon of long head of biceps brachii passes through this. And then the fourth one, that is the glenoid labrum. It covers the margin of glenoid cavity and it deepens the glenoid cavity. We already said the glenoid labrum has its main role in deepening the glenoid cavity. Now let's understand the ligaments with the help of a diagram. This is the sagittal section of the shoulder joint. You would have seen this in your books. So the capsular ligament, this is the capsular ligament, this green color thing. As you could see that it nicely rotates it is present around the glenoid cavity of the scapula. So this is the capsular ligament. This is the sagittal section of the shoulder joint. Next is the coracohumeral ligament. As the name suggests, it is between the coracoid process of scapula and humeral bone, humerus. humerus. Next is the transverse humeral ligament. So here, this is the transverse humeral ligament. It is present between the bicipital grooves. This is the bicipital groove, and this one is the bicipital groove. So it is present transversely along the bicipital groove. That is why it is called transverse humeral ligament. And next one is glenoid labrum. We already said that this blue color thing is the glenoid labrum. It functions to deepen the glenoid cavity so that the head of the humerus could attach freely into the glenoid cavity. Next, let us see about the accessory ligaments. That is, there are two accessory ligaments, that is coracoacromion ligament and coracoacromion arch. So the coracoacromion ligament, the name itself suggests it is between the coracoid process and acromion process of the scapula. Next is the coracoacromion arch. We already said that the coracoacromion arch is formed by three structures, that is coracoid process, coracoacromion ligament and acromion process. So here, acromion process, coracoid process, coracoacromion ligament, these three together contributes to the coracoacromion arch.